Hi, my name is Jennifer Marshall. I'm an LVN, that's a licensed vocational nurse. I am giving a speech today on how to give a subcutaneous injection, and I will be demonstrating on this here lovely bunny. We will not be hurting anyone in the process of this film. The first thing you do is grab your supplies, which is, for subcutaneous, is a TB syringe. It has a 30 gauge needle tip, which is the smallest needle tip that you can use to go in the subcutaneous tissue. After you grab your proper syringe, you grab your medication, which we will not be using medication, this is just normal saline, but it's in an injectable, as you can see. And you grab your alcohol swabs. Now, we are going to go over here to the said bunny, and we are going to do our subcutaneous injection. Hello? First step is to tear open the alcohol swab. Now, in finding the subcutaneous tissue, you are to find either in the arm subcutaneous tissue, which is fatty tissue, right here, or you could use the abdomen, or you can go in the thighs. This bunny has more subcutaneous tissue in his leg. So what we are going to do is use the leg, the thigh today. I'll put this over here for just a minute. Now, when using a 30 gauge syringe, you have to pull back the amount of medication that you're going to use in the syringe, which today we're using half a milliliter, which is going to draw back to the 50 on the syringe. I'm pulling back air into the syringe so we can inject it into the injectable medicine, and the reason for doing so is because you need to equal out the pressure inside of the injectable. So I'm going to demonstrate that. Now, when popping this, you usually don't have to wipe the top with alcohol, but if it's already been popped, to keep bacteria off the top when injecting any needle on top, you don't want any bacteria on your needle. Now, the air that I pull back on the syringe is going to be injected into the medication that you're using, as like that. And without removing the needle, you're going to flip it over and pull back the same amount of air that you injected, which is the amount of medicine that you're going to be giving the bunny on the bed, which he is going to be getting half a mil, which is milliliter. And you quickly pull that out. It is very important to also know that you do not recap your needle. Whenever, with your other hand, we do the scoop technique, and what you do is gently just go below, scoop up, like that, and then you can secure it with your other hand. Now that you have your medicine, the correct dose, it is always good to have your partner that's working with you or whoever is next to you, especially if you're giving insulin to your patient, the correct amount in the syringe, which is correct. You also check for bubbles that are in the syringe. If there's any bubbles in the syringe, you pull back and you just pull it all the way up, and there's no needles, or excuse me, no bubbles. Now, we are going to inject the bunny with our sodium chloride in the thigh. No, we are going to give you your medicine now. Now, when giving the injection, you need to find the proper area of fat, which right here would be a good area. And you just clean the area in a circular motion. You uncap the needle, and then you squeeze up the amount of skin, and with a 45-degree angle, it's going to be right about here. If you're giving a different medicine in the muscle, you'd be going in a 90-degree angle, but since you're going in the subcutaneous tissue, you're going to be going 45-degree angle. So they will feel a pinch and a sting on the injection. 1, 2, 3. And whenever you're injecting, you need to pull back before injecting the medicine. And to do that, it's to make sure you have not hit a vein. And then you inject the medicine slowly and pull out. Now, at this point, you would put it in the sharps box, but we do not have a sharps box readily available right now. So I'm going to hand it over to a personnel that will take care of that for me. Now, the reason that you pull back before injecting the medicine is to make sure that you don't hit the vein. If you pull back blood, you need to automatically just pull the needle out without injecting the medicine because you've hit the vein, and that's not a subcutaneous injection then. In this case, the bunny did not have any vein interruption, so we did the shot properly. Now we will cover the bunny up. Now, I hope that y'all have all learned how to give a subcutaneous injection. Just to go through it one more time, it is fatty tissue, it is right below the dermis and above the muscle tissue. And to give it properly, you have to use the steps that I've just explained, and also go to nursing school first. It's very important. And I believe that's the end of my show. Thank you.